Hi, this is ALO Talks. I'm Luigi, your host, and this is Andre, co-host. Where I'm an MSK physiotherapist by background. Andre is a men's health physiotherapist. We're here with Neil, part of the management team at ALO. We're going to use this episode as episode 1 to just explain what our podcast is really about. And Neil's here just kind of facilitate our
Yeah, Jonathan, a bit too. I mean, I think it's a great idea, guys. I mean, I see the business from slightly a different lens to you, but I know we do some great stuff with the patients. We see a lot of different cases. So I guess tell people why we're here. Like, why are we trying to do this podcast?
Yes, I think the first idea that came about was me and Luigi chatting the importance of the patients to understand certain terms so they are able to educate themselves, consequently make the changes that are necessary for their progress. So the idea was me and Luigi talking about the physiotherapy and the importance that the patient can actually understand what we are doing, what their pathology, and how we could break it down
Yeah.
in a very simple terms so the patient could start to integrate more and make the changes. One of the most important things that we see is accountability. So sometimes you say to the patient, improve your ROM, range of movement. But it's a language that me and Luigi know very much. But or a pathology, bursitis. What are you actually treating? Bursitis, and then explain it down. So the idea came up of bringing the specialists where they will break down the jargons. So the patient will be able to understand the pathology, understands better what we want to achieve, and integrate them into the process of healing.
Absolutely. I think, in summary, I think we're just trying to like uncomplicate a complicated or complex situation for the patient, right? Because I think a lot of physios, a lot of medical practitioners will talk in medical terms, and most patients will sit there and kind of nod along or say yes, okay, fine, without really asking too many questions.
Yeah. And these patients are coming from a place of they're probably in need, pain,
Yeah, yeah,
so we're trying to break that down as well, aren't we?
yeah. There's a lot of things going on. So in that initial point with our patients, we try to like break down that barrier.
Yeah.
I've quite open up to my patients, say, if you've got any questions, stop me, talk. But in this podcast, we really want to break down
Yeah.
essentially complex scenarios for patients so listeners can understand, and when they go in or have a problem, they might be a bit more confident in understanding what's actually going on, what's being said to them.
Yeah.
And Andrew's right, like we want to bring in the consultants because they're going to be specialists in their area, specialists in their fields.
And you guys, to give you credit, are specialists in your fields, right? I mean, I don't think people always, they think physio and they might think of like an ankle pain or a knee pain, but actually we cover such a broad range here. And I think that was the other driver of the podcast is we see a lot of different stuff, men's health, women's health, very specific cases. And I think that maybe helps us to sort of maybe share a bit of that, but again, keeping it simple.
Yes, this especially with this idea that our clinic is very specialized in terms of we have physios that occupies with the upper limb,
Mm.
lower limb, the spine, as well as women's health and men's health. So this creates a enormous variety within the team. And consequently, I think having this idea of inviting specialists on these specific areas will allow first a better understanding for the audience, for our clients. Secondly, will allow us to interact with the patient better,
Yeah.
because if the patient understands the terminologies, they will be able to engage on the process of healing faster.
Yeah, it's so important. And the thing talking about engaging them and making them heal faster, if they have that understanding, it's so much easier. Not only for us as physios, when a patient comes to see us, but whether they go and see another physio and they've heard our podcast. I think that's where we're really aiming for.
Yeah.
Our target audience here is the patient.
Yeah. And so some of the topics we're going to cover in this podcast, are they based on what people that we see, these sort of more general more popular cases? How are we sort of deciding what the podcast is going to have?
So again, Andre's touched on it. We've got vast knowledge in clinic amongst our clinicians.
Yeah.
We have different specialities, but we also have a large contact list of orthopedic consultants, sports scientists, psychologists. So it might not just be practitioners from like a physio basis. There may be people that you probably wouldn't hear on like a normal
No.
or a standard medical podcast.
Yeah.
So we might be speaking to like HR bosses or CEOs and people that like,
Yeah.
how
It'd give us a different perspective on like how physio can help.
Yes.
Sounds like we're going through Andre's address book as well.
I was chatting with a supporting lecture professor at UCL, and he is very keen to take part as well. So a colleague. So therefore, that will be a very interesting chat. We have contacts over the continent, in Spain, in Italy, and inviting those physios and professionals to give their take.
Yeah.
And I think this is the wonderful thing, like understanding what people are doing, their different specialities, so we as a clinic and consequently our patients will benefit from this process.
I mean, that's how you guys run the clinic, right? I mean, it's always that trying to get ahead, thinking of like what's the next thing that can help patients. But I think the way you approach it and really try and help the care of the patient, I think that's key. So I think, all of this sort of fits that. It's great. It's great you're sharing that as well on the podcast. I mean, I think one of the things would be really helpful just to give a context for the podcast is maybe to get to know you two as well. You've got a lot of experience. Tell us a little bit about physio and how you got into it and how you got to now.
I'll start. So quite cliche, I think. I got into physio because I used to play football as a teenager growing up, pick up quite a few injuries, picked up quite a significant ankle injury, went to see a physio. I thought, actually, if I'm not going to play pro, as everyone says, that seems like an interesting career for me. So I took the path of going down the sports science route first. So I did the degree, a BSc in sports science. Then I went and did a BSc in physio.
Right.
And after that, I went and worked in pro football for a decade and then found myself in clinic.
So you've really seen it. You've seen all the injuries.
So I've seen quite a few in my time, yeah. And that's where my interest in kind of lower limb really developed. So that's my background in summary, and I think that might be a bit quick, but
No, I mean, it's great. But I mean, it's nice to think of you then bringing all that experience into the clinic, as we do and all the patients you've seen.
then again, coming into clinic here, one of the reasons I came to work with Andre is not only personal kind of connection you had when we first met, I think, also knowing how Andre delivers his physio, how the clinic's set up with the tech to aid in kind of pain management, all things I would have done in pro sport, we have it here in clinic. So it was kind of a great fit, and that's
a great story. Andre, for yourself?
Yes, it always started, my first degree was in sports science back in Brazil. And then I always had that focus of I want to specialize more on people that after an injury, getting them to their best of their shape, really. And then I said, I think I'm going to study physiotherapy in England. I didn't quite know what to focus on, but I did all the applications, came over, and then started studying physiotherapy here and graduated in 95, 94, 95.
Yeah.
Then went to the Royal London Hospital and stayed about 4 years there. And then in between, when we still had the London Chest, I was doing part-time at the London Chest and opened up the physiotherapy clinic here in Harley Street. And and then our story started in that sense. And over the years, I specialized a lot on spine physiotherapy. And then for the past for the past 7 years, I turned all my knowledge that I had on spine into men's health, mainly because I had a problem myself with prostatitis.
Yeah.
And that triggered me investigating a little bit more. I wasn't keen on just getting medication. So I started connecting friends on the continent to find out what they do, how they approach,
Yeah.
and got great results. So through the experience, I decided sharing that with the men's health community. It's been fun and being able to break the taboo, because we as men, we don't talk as much. It's not that you go to the pub and ask, how is your prostate doing? But it's something that perhaps we should. These are one of the things that I started to advocate on this side, is to break this taboo, make people feel more relaxed about it, understand what they are going through, so they are able to make this the change that they need. And thinking on this, bringing that into all the other specialities. People with ACL, they don't understand sometimes the reconstruction process and how would take them A to B. So then it's nice to get like someone that would interact or give information on that. The same for women's health. The same for a shoulder specialist, hip specialist, spine specialist.
And I think, to me, that's the big thing about how you guys approach all of your work, is very much a case of helping the patient really understand it, but also give them a clear path of how they're going to get there. This isn't just to sort of send them out with some information and hope they're going to get better. It's actually very sort of hands-on, but lots of sort of help to support them through that. And I think that comes across in all the specialisms you guys have.
Yeah, very much. And this comes a lot closer to our values, which we think that the healing, it starts from the ladies on the reception, where they pick up the phone and they interact and genuinely want to know how they can help you. And then the process starts. So healing starts right there on the reception.
And again, we want to extend healing through education in clinic, like you're talking about.
Yeah.
And spread a bit more information out there.
Yes. And another thing, we would like to also inspire our audience to actually send us topics that they are keen to understand or hear more about. Because I think this will make it very interactive.
Definitely. Well, I mean, there's so many issues we see, people regularly having. There's got to be a lot of those sort of topics that actually bother, people when they want help on or they're thinking about. So I think it's great. Yeah, it's going to be great. Really good.
Yes. So yeah, in summary, we're ALO Talks, and we're here to make the complex a little less complicated. You've been listening to ALO Talks. If you've enjoyed this episode, don't forget to like and share, and consider leaving us a comment on the topics for future episodes. See you next time.